The goal of my research is to decrease early deaths after trauma due to hemorrhage. So my research focuses on emergency interventions. So if you look at trauma as a disease process, it actually is the leading cause of death for people 45 years and younger. And if you look at the distribution of deaths after trauma, they tend to occur in 3 spikes. The first spike is immediate, people who don't make it to the hospital because they die right after the injury on the scene. The second spike is early deaths, people who die 1 to 3 to 4 hours after injury, after they get to the trauma center. And then the late spike is usually 2 to 3 weeks after admission. The late spike has largely been alleviated by research into things like treating sepsis infections and treating multi-organ failure and nutrition and ventilator strategies. But the rate of early deaths continues, and it's mostly due to hemorrhage and brain injury. The clinical trial that I'm running right now focuses on what type of emergency abdominal operation we do. One of the most common sources of bleeding is intra-abdominal bleeding. It's from the liver, from the spleen, kidneys. 30 years ago, researchers from Emory in Atlanta and the University of Pennsylvania in Philadelphia described this type of emergency abdominal operation where the whole operation is staged. So in the first operation, you would control bleeding, you would control contamination from the GI tract, you would take the patient to the ICU, continue resuscitating them, and then bring them back the next day and finish everything. And that kind of staged abdominal operation became wildly popular in the United States. There's never been a clinical trial actually looking at the effectiveness of this intervention. So the one going on right now is the first clinical trial where we randomize people to either having a staged operation or having a complete definitive single stage operation. We're looking to enroll about 50 patients, and we're looking at abdominal complications and mortality following either the single stage or the staged abdominal operation. If people wanted to donate money, they could donate it to the Center for Translational Injury Research. We have research assistants in the hospital 24/7 to perform emergency research.